Hello dear friends, I have the privilege to introduce to all of you JIPMER 2017 November student rank 47 Dr. Vignesh Raja K. And I would like to congratulate you from the entire DAMS family for getting such a good rank.
Yes.
Okay, so your journey with DAMS, I'd first start with this. How did your journey start with DAMS?
Yes, sir. I started my journey as a foundation batch student from Pondicherry. In fact, I am the first student of DAMS Pondicherry. I joined the foundation batch during my final year. Then I continued it during my internship. And now I did the TND from DAMS Thrissur to the year 2017. And it was really a hell lot of experience with DAMS. Not only for the PG exam, I would say even I passed my MBBS exam only because of the DAMS.
Okay.
So I'm extremely happy for it.
Great. So as you could listen, he has been our student for the last 3 years. And the two things what I'd like to ask him is, what is the difference being a foundation batch student in final year?
Yes, sir. I had also students with me from third year. In final, specifically what I felt is they were teaching medicine, surgery, OBG and peds. I was able to imbibe more than my juniors who were sitting with me. So I feel it's very, very special to be a foundation batch student in a final year. They say final year is hectic, you can't study, but I felt it was very helpful for me, particularly the notes which DAMS provided. I was even able to crack my practical tests with the Viva, everything. So it's really good to be a foundation batch student in a final year.
Great. So how was your experience with TND? Were you regular with the test, or you just dropped in to just listen to the discussion? How was your look into this?
No, sir. I attended all the tests regularly. The 1 hour test which we give, though there are only 75 questions, it gives you a lot of confidence, and also it is discussed by the faculty immediately, so it helps to boost your memory also. I did that question wrong in the TND exam, so I will never get it wrong the next time. So it was very, very helpful.
Great. So I can take 2 summary points from here, that when he did the foundation batch, he was able to gain the concepts which not only helped him for the MCQ pattern exams, but it also helped him for his MBBS exams. Now this is very important. And then when he shifted to the TND batch, he told that he was very regular with the test, and that errors which he made in the test were never an error in the main exam. So dear friends, this is a very important take-home message. You have to be regular with your tests. Okay, the next series of questions what I would like to know from you. How was your strategy? Like, were you a student who used to be a bookworm, or a student who was smart in his studies? What would you rate yourself to be?
Yes, sir. I was never a bookworm. In fact, you can call me a notes worm. During my final year also, I read only DAMS notes.
Great.
And then I continued to read the same thing during my TND, and I added the extra edge points to it, not from the TND as well as from the updates posted by the teachers. So what I learned is you need not do something extraordinary, or you need not do new things every day. You have to keep doing the same thing each and every day. Revision is the key thing. So I feel doing the same things again and again will fetch you more marks than trying to do some extraordinary things.
Great. So DAMS notes, repeated revisions, 2 take-home messages what every student should know from this topper's talk. Great. Now, if I would like to ask you, what role does a textbook play in your revision?
Sir, nothing. Actually, I didn't even touch even a single textbook in the past 1 year during my TND. All I did was DAMS notes and CRS MCQs. That's all. And before going to the exam, I passed 2 or 3 papers. Nothing else.
Great. So what was your experience with the grant test, subject-wise test? Were you regular in that, or you gave it at the last?
No, sir, I was regular. Every month it comes on the first Sunday. I used to give all the tests on the Sunday itself, and then I attended video discussion the next Sunday. It is also very helpful. For example, the subject faculty himself will discuss how to crack that MCQ. In an exam like JIPMER, I didn't know 100 questions what were there out of 250, but with the guidance provided by the faculty, how you should approach a question, even if you don't know that, That really helped me a lot.
Great, great. And what was your rank in CBT?
My rank was 106.
106. So one more take-home message. Rank 106 CBT changes into rank 47 JIPMER. So please take your exams seriously, the grand test, the CBTs. It has a great impact on what your future will be. Now, one more personal question I had asked you. What was your single most driving force to get such a good rank?
It's my passion. I missed JIPMER during my MBBS studies. Now I study in Pondicherry Government Medical College. That was the single most driving passion. At least during MD, I have to get into JIPMER.
Great, great. So passion has driven this topper to do so well. Now, one more thing which I would also like to know over here is, would you like to tell one single message to all the students what they should plan to do if they want to get a similar rank like you? What would be that message?
Yes, sir. I can divide it into two parts. What you have to do during the preparations time and what you have to do during the time of exams. During the preparation time, I will ask everyone to please stick to notes. Don't do any extra things. The notes are sufficient enough and can get almost all the questions asked even in AIMS, JIPMER and PGI. So do notes repeatedly and have a strategy in your mind, have a timetable, follow that strictly, try to finish it. With a course like T&D, you will have that thing in mind that I have to finish this subject by this Wednesday. So that gives us a deadline before which we have to study. And during exams, you have to be very, very mindful. It doesn't matter even if you don't study for 1 week before exam. What really matters is what you do in the 3 hours during exam. To be very, very mindful. Look for the keywords. Look for each and every word in the MCQs. And try to, even if you don't know the questions, nothing wrong about it. You have to try to match words from the MCQs, match words from the questions and answers. And particularly in an exam like JIPMER where we have only 25% negative marks, you can go and attend around 240 to 245 questions.
Great. So you could hear it from the topper itself. Do not panic in the exam. And second, there is no role of play safe strategy. You have to go for a score of 240 or 45 in the JIPMER exam if you are planning to crack the exam. And last and not the least, even if you do not read for a week before, you should not panic, because it is the 3 hours which is going to determine your entire rank in the exam. Some subjects, what you would like every student to pay a focus on.
For JIPMER, sir?
Yeah.
Yes. For JIPMER, particularly this parasitology, you have to focus on this protozoans very much. Before the JIPMER faculty is a parasitologist, so he will ask at least 10 questions every year, every time in parasitology. And PSM, biostatistics, is one thing which I found is very fruitful. And then tumor genetics chapter from pathology, which Diksha ma'am had covered in mop-up. And finally, in a surgery and medicine, they ask very basic questions, so we can answer them quite easily.
Great. So he has specifically outlined the topics which you have to watch out for the coming JIPMER exams. Please do not forget it. Parasitology, biostatistics and tumor genetics. These are very, very important. Please do not miss out on these. Any specific teacher who you would have said that has touched you so much from DAMS or from your institute, whom you would give a big deal of credit for this particular achievement of yours?
Yes, sir. I would give a big deal to Deepthi ma'am. I think her notes is a gold standard for any PG aspirant. I also think that even during their MS OBG, they can read only those notes.
Great.
They are such valuable things. Particularly the touch-up which she gave during the T&D also helped us very much. It covers all the points from A to Z in OBG. And Diksha ma'am for her updates. Those are really very, very sweet, and you know it doesn't give you the pain of learning. She will insist on your mind like a story, and use her for that Blue Aims challenge. That was really good. Those videos and those examples for management, I will never forget it lifelong.
Thank you. Thank you. So Again, we would like to congratulate a great achiever, rank 47, probably a dream of many of the common students across the country who would like to strive, the passion what this young doctor had developed to crack JIPMER, one of the premier institutes of our country. Thank you and all the best, man, and be a great doctor. Last, which subject are you eyeing on to take for your life?
Yes, sir. My passion is radio diagnosis.
Great.
I don't think so I will get in JIPMER, but I will take only radio diagnosis, sir.
Great,
Yes.
great. So all the best. I hope you turn out to be a great radiologist for the country, and thank you for being a very special part of our DAMS family.
Thank you, sir.
Thank you.
And I would also like to thank my parents and sister and my friend who have been a constant support of morality and everything till this level. Thank you.
Great. So without parents, probably nothing is sweeter. If they are there by your side, you get every bit of happiness. So thank you for being such a good sport in the entire journey with DAMS.
Thank you, sir.